Hi, and welcome to Berry Aftercare. If you're listening on the podcast, I welcome you. And if you're watching this live in Berry Aftercare, I welcome you as well. This is a different kind of podcast today, a different kind of presentation. I'm going to talk about that article that I've been talking about for the last several weeks. And I'm actually going to share the information from an article that I found online that to me is brilliant. It sums up a lot of information we've been talking about in the past couple of weeks. And not only that, from a personal perspective, this information in this article really supports what I have been trying to talk about for the last several years in the bariatric community. Not just me, but many people as well. And so the more people who become aware of this information, I think the more people will be helped because of it. And I think, as I've said many times, a lot of people who have weight loss surgery go into it with the hope that the weight loss surgery obviously will get the weight off, and that typically happens. And yet, a lot of people are hoping that it will take care of every issue in their life, and it absolutely doesn't. Regain is a huge problem, couple of years out from bariatric surgery, and we want to prevent that. So, we've been talking the last couple of weeks about some childhood issues that have been shown to be related for some people, clearly not for all, in terms of affecting their ability to follow through with the gotta do's, to follow through with the behavior modifications that are essential to successful weight maintenance. So I'm not going to spend a whole lot of time blabbering on here. I'm going to get on to this article. The article is about obesity and adverse childhood events such as abuse, neglect, unresolved grief, trauma, that sort of thing, which I've been kind of alluding to and going into minimal detail over the last couple of weeks. So today I'm going to go over an article, and the article is entitled Obesity Problem, Solution, or both. And I will put the information to the article. So if you want to read the article in its entirety, you can. And I would definitely encourage you to do that. In fact, I would encourage you to share this information with anybody you know who has had weight loss surgery, as well as any professional who works in the bariatric community, to include the surgeons, the bariatricians, who are weight loss doctors, but they don't do surgery. They usually do medical weight loss. PAs, nurse practitioners, nurses, psychologists, other mental health workers, uh, dietitians, exercise physiologists, anybody who works with the bariatric population should read and have this information made available to them. So I'm basically just going to go on and I'm going to read a bit from the article, just a sentence or two, and then I'll just give you my 2 cents on that. And here's where it came from. And this is a quote directly from the article. Since 1982, the Southern California Permanente Medical Group's Positive Choice Weight Loss Program in San Diego has treated more than 30,000 adults, prominently middle-aged, for obesity. End of quote. So this article was written in 2010. So from 1982 to 2010, this group of Kaiser Permanente in Southern California at a weight loss program called Positive Choice Weight Loss Program treated over 30,000 adults. They go on. This has been an extraordinary experience and provided us with numerous counterintuitive observations. We are now convinced that obesity is widely misunderstood. So the authors of this article, who are physicians who are working in this weight loss program, say, wow, we thought we knew what we were doing when we started this program, this weight loss program. But we have learned so much through our observations, which are counterintuitive, which means they don't really make a whole lot of sense to us. And so We have become convinced that people do not understand fully the disease of obesity. They go on to say, in the early years of the weight program, we naively were taking people who were suffering from morbid obesity down 300 pounds at a time. So they were helping these people lose tremendous amounts of weight. And they say that's a rate of loss distinctly exceeding that of bariatric surgery. So the patients that they had in this program were losing weight more quickly than people who had weight loss surgery. And what they said is the striking results, perhaps understandably, led us to believe that we understood what we were doing. So they have this group of patients, these thousands of patients, they're losing weight so quickly. So they were like, wow, we really know what we're doing here. And then they say, counterintuitively, some of our most successful patients forced us to realize that we were merely in possession of a powerful technology and had no idea what we were doing in other regards. So here what they're saying is we had a powerful technology to help people lose weight, which was basically an all liquid diet. And that worked in terms of weight loss. But what they realized in addition to that, they found out we had no idea what was happening other than the weight loss. And here's how they say the patients taught them this. The patients did this by demonstrating that massive weight loss could precipitate divorce, severe anxiety, and sometimes suicidality. They were shocked. These doctors were shocked. They were like, we didn't know that there would be so much connection with this rapid weight loss to things like divorce, tremendous anxiety, and sometimes suicidality. Now, the results from research based on post-bariatric surgery show some of these same results. Divorce rates for post-ops, 70%. Increases in anxiety, and there are some increases in suicidality. So they were like, we did not expect this. They go on to say some patients, sensing these outcomes early, fled their own success in the program. Surprisingly, our high dropout rate was mainly limited to patients who were successfully losing weight. So they didn't understand. Why are these patients who are losing weight dropping out of the program? We don't understand this. So they were saying, you know what? Some of these patients, maybe they were sensing these outcomes. Maybe they were sensing increases in anxiety or trouble in their marriages as the weight was coming off. On the other hand, they say, we had other patients who were eating during the program. This was an all liquid diet, so they weren't supposed to be eating. They were routinely denying that they were eating, and they weren't losing any weight. However, they stayed in the program and they were paying a significant fee. It was costing them a lot of money, seemingly to accomplish nothing. With these patients, said the doctors, it took some time for us to realize that we were supplying an important support system with our group approach. It turned out that many of our obese patients had no functional support systems at home. So they have all these patients who were, quotes, cheating. They were eating while they were on an all liquid diet. But they stayed in the program, and they figured out they did so because they were getting some support here in our group program that they weren't getting elsewhere. They go on to say, the striking and frankly annoying conflict between our ability quickly and safely to reduce a person's weight and what patients appeared capable of tolerating, what they were able to tolerate emotionally, led us to detailed exploration of the life histories of 286 of our patients. So they take this information of people dropping out even though they're gaining weight, of people sticking around who aren't even following the program. And they were annoyed by this. They were like, this doesn't even make sense. We got to figure out what's going on here because the patients don't seem capable of tolerating what they're experiencing emotionally while they're losing this weight. So we need to study this. So they did detailed life histories of 286 patients. Let's look at what they found out. Here they say, we unexpectedly discovered that histories of childhood sexual abuse were common, as were histories of growing up in markedly dysfunctional households. Oh, so they're like, we are onto something here we had no idea about. They go on. It became evident that traumatic life experiences during childhood and adolescence were far more common in an obese population than was comfortably recognized. So here they're saying, well, it became obvious. This was really obvious, but it was really uncomfortable for us. We were not comfortable with this information. We're weight loss doctors. We're not supposed to know how to treat this other stuff, and they're not. So they go on to say, we slowly discovered that major weight loss is often sexually or physically threatening for the patient, and that obesity, whatever its health risks, is emotionally protective. Whoa. So that to me says, okay, this is confusing to these weight loss doctors. It's not confusing to me, and it might make sense to you. But what they were saying is that when people lose this weight really quickly, if they've had a history of sexual abuse or dysfunctional childhood lifestyle, that this weight that they've been carrying around, even though it's causing health problems, protects them emotionally from the vulnerability they may feel without the weight. Stay with me here. These doctors say, ultimately, we saw that certain of our more intractable public health problems, such as obesity, are often unconsciously attempted solutions to problems that date back to the earliest years, but are hidden by time, by shame, by secrecy, and by social taboos against exploring certain areas of life experience. So they're like, wow, maybe other health problems, but definitely the problem of obesity and all the problems it causes, maybe subconsciously, weight helps people to hide this shame, these secrets, these things that we don't talk about, or at least didn't many years ago, right? The antecedent life experiences, which means the things that happened earlier in life of our obese patients, are quite different, they found, from those of people who never ever had a weight loss problem. Now, check this out. Many of you may or may not have, but if you're a healthcare provider, you probably have heard of a really large study of 17,000 people called the Adverse Childhood Experiences Study. Really a fascinating study. But anyway, the research that I'm talking about today, done by these weight loss doctors, is what led to this huge study done by Kaiser Permanente. So the doctors say in this article, eventually, these program findings, what they learned in their study of weight loss, led to the Adverse Childhood Experiences Study, which is also commonly known as the ACEs study. It included 17,000 research subjects. And during that study, They established that the developmental damage, that means stuff that occurs while you're growing up, while you're developing as a child that hurts you, in the obese study, in the obese patients that we studied, was broadly applicable to many aspects of everyday medical practice. So not only did they learn in this ACEs study that these negative childhood events affect weight, and we're talking obesity, not overweight, obesity, the development of obesity, but all kinds of health issues. These doctors say, ultimately, we learned from our patients that with obesity, we're dealing with two core problems. This is huge. And the two problems that they discovered they're dealing with in dealing with their obese patients were the unconscious. So the patients aren't even aware of the compulsive use of food for its psychoactive benefits, meaning it calms me down. It helps me feel better. Food makes me feel better. But a lot of people aren't aware of the connection between compulsively using food to the point where it's affecting their health for the sake of helping them feel better. So that was one of the things that they realized is one of the problems. And the unrecognized and unspoken benefits of obesity. So if you are a patient who struggles with regain, then I want you to listen very, very carefully. Because for some of you, not all of you, there are benefits, and we talked about this briefly before, of maintaining the weight loss. When I poll people on Facebook, you know, what happens when you lose weight that, leads to regain? I don't like how I feel. I don't like how I start feeling. I'm afraid of my emotions. I don't like what I start thinking about. So this is exactly what these doctors were encountering. So they go on to say, these two core problems are markedly at variance with conventional thinking about obesity. So what that means is in most weight loss programs, whether they be medical or surgical, that's not what we think about obesity. Physicians and most other weight loss professionals think about weight from a strictly medical perspective. And I get that, as they should. They're trained to treat the medical issues. But what this is saying, whoa, this doesn't fit the medical model. This is very unconventional. And they're figuring out if we don't deal with these other issues, it might be real hard for our patients to keep their weight off. So they go on to say, worse yet, these two basic problems of using food to feel better and, realizing there are benefits for people to keeping their weight on. They say, worse yet, these two problems are uncomfortable to deal with. As physicians, they're saying, we're not comfortable dealing with this. And I understand the reasons for that. They go on to say, any physician who chooses to validate in the patients the points being made here. So if a physician has the kahunas to talk to the patients about their early childhood events and if there were problems in their developmental years, they say any physician who does that will be in a position of asking about topics that we've all learned along the way are not discussed by polite people. Oh my. Incest, rape, family suicides, parental brutality are not readily brought up. That being the case, we physicians typically have no basis for opinions on the frequency or rarity of such life events. What they're saying is we are really unaware of how often trauma happens in the lives of our obese patients. When I work with surgeons personally, and I say there's a lot of unhealthy drinking that happens after surgery, there's a lot of regain. There's a lot of people who have suffered from sexual abuse that are struggling with regain. There are a lot of people who've had a lot of Does that really happen, Connie? I don't hear about it much, is what the surgeons say to me, because they don't know. And that's what these doctors are saying. We don't ask about it, so we don't know about it. And the truth is, with your surgeons, how often do people even see their surgeons after surgery? Some don't ever see the surgeon after bariatric surgery. So the problems in this are so multi-leveled. So the surgeons have so much influence with patients. But if the surgeons don't know about these things, they're not mentioning to the patients, you might want to seek, therapy. There are a lot of issues that might surface after surgery. Or if you're really struggling with regain, you might want to seek a therapist. I've learned that there are sometimes issues that happen in childhood that affect regain. But the surgeons don't know about this stuff. That's a problem, right? So these doctors say, we documented these experiences as surprisingly common amongst our patients, but we didn't know that before we began asking about these. So these weight loss doctors who had all these people losing weight, but the ones who were successful were dropping out, they were like, we didn't know these were issues. We were shocked. We didn't know these. They're common. So the doctors are saying we need to know about these. They also say we learned that discussion of these experiences is not comfortable for the doctors, but the patients don't mind talking about them, right? The patients can handle it if they're talked to by someone who's supportive, who's compassionate. They find a lot of relief, the patients do, in talking about these things, but the doctors don't ask, partly because the doctors are uncomfortable, right? So it's important. And the doctors say the poignant point of this says that we doctors have a huge responsibility that we can avoid by falling back on not having enough time with patients or not having had enough training. That's why we don't ask about this. So a doctor can always just throw their hands up and say, well, I don't have enough time to deal with this, which is true. I will give doctors that. They don't have enough time about it, nor were they taught about it. So I get that, and it's true. However, they can learn, they can read this, and they don't have to deal with it on a psychological level, but it would be really beneficial to patients if their doctors would say, there's a lot more to obesity for a lot of people than just their weight, than what they're eating. There's reasons for this. There's reasons regain happens. Maybe we need to employ somebody to talk to our patients about that. Maybe we need to refer our patients to people. Absolutely. All right. So, again, they talk about how the ACEs study of 17,000 people came from this study that they did. So I'm going to jump off track from this article by these doctors because you're probably curious, what are these ACEs questions? What are these adverse childhood experiences? So I'm going to read you the adverse childhood experiences, and you can count how many you may have experienced in your lifetime. So these are the actual questions from the Adverse Childhood Experience Questionnaire. While you were growing up during your first 18 years of life, number one, did a parent or other adult in the household often, not once or twice, but often swear at you, insult you, put you down or humiliate you, or in a way that made you afraid you might be physically hurt? So when you were growing up, was there somebody in the household who regularly swore at you, insulted you, criticized you, humiliated you, or frightened you to the point that you thought you might be physically hurt? So that's question number one. So if that happened in your life, hold on to one of your fingers because that's going to be part of your score. The second question is, while you were growing up during those first 18 years of life? Did a parent or other adult in the household often push you, grab you, slap you, throw something at you? Or were you ever hit so hard that you had marks or were injured? Yes or no? So if that applies to you, give yourself another point. During your first 18 years, did an adult or person at least 5 years older than you ever touch or fondle you, or have you touch their body in a sexual way, or try to actually have oral, anal, or vaginal sex with you? Sexual abuse. Did you experience sexual abuse before the age of 18 by somebody at least 5 years older than you? And I know for a fact that 1 out of 3 females has, and 1 out of 4 to 5 males has. So, what about you? Next question. Did you often feel that no one in your family loved you or thought you were important or special? Or your family didn't look out for each other, they didn't feel close to each other, and they didn't support each other? So, does that fit for you during your first 18 years? The next question, the fifth one. Did you often feel that you didn't have enough to eat, or that you had to wear dirty clothes and had no one to protect you, or that your parents were too drunk or high to take care of you or to take you to the doctor if you needed it? So here we're talking about neglect, right? Did you often feel you didn't have enough to eat, or had dirty clothes, or no one protected you, or your parents were too drunk or high to take care of you or take you to the doctor? That's number 5. Number 6, short and easy. Were your parents ever separated or divorced? Number 7, was your mother or stepmother often pushed, grabbed, slapped, or had something thrown at her? Or were they sometimes or often kicked, bitten, hit with a fist, or hit with something hard? Or repeatedly hit over at least a few minutes? So were they beaten for more than a few minutes? Or were they ever threatened with a gun or knife? This is called vicarious abuse. Did you ever witness somebody else in your home being beaten for, often, or for more than a few minutes, or threatened with a gun or knife? Number 8, did you live with anyone who was a problem drinker or alcoholic, or who used street drugs? There's only 2 more. 9, was a household member depressed or mentally ill, or did a household member attempt suicide? And the last one, did a household member go to prison? So add up your yes scores, and this would be your ACE, ACE, Adverse Childhood Event score. And what they say about the scores, and this is the CDC, Centers for Disease Control. This was their study, the Center for Disease Control Adverse Childhood Experience Study. So it's not just some random fly-by-night unit doing this, right? What they uncovered was a stunning link between childhood trauma and the chronic diseases people develop as adults. Obesity is one of those chronic diseases that people develop as adults. So there's a stunning link. Physicians need to know this. Bariatric professionals need to know this. Bariatric patients need to know this. So this includes heart disease, social issues, emotional problems, lung cancer, diabetes, autoimmune diseases, depression, violence, being a victim of violence, and suicide. So these childhood events that are traumatic lead to all kinds of problems in a person's adult life. And yet they'll say, oh, I put that behind me. That didn't bother me. That was in the past. It doesn't bother me today. And I disagree. It does. Somewhere deep down inside, it's bothersome. So when they did this ACEs study, They published the first results in 1998, and there's been many, many more, over 70 more publications from results of this ACEs study through 2015. And I'm sure there's been a lot more in the past 6 years. So here's what some of the results from finding out that so many children have been experienced trauma, neglect, abuse. So here's what some of this research says. Childhood trauma is very common, even in employed, white, middle class, college educated people with great health insurance. And they know that because this study was done on people who had Kaiser Permanente health insurance, many of whom were white, middle class, college educated people with great health insurance. All right. There was a direct link between childhood trauma and adult onset of chronic disease, as well as depression, suicide, being violent, or being a victim of violence. So look at the people around you and look at what's going on in their lives. And for many of these people, it's kind of a neon sign that there was some trauma in their childhood. Not for everybody, but for some people, for a lot of people. All right. More types of trauma, so the higher your score, increase the risk of health, social, and emotional problems. Next, they learned that people usually experience more than one type of trauma. It's very rare that only sexual abuse or only verbal abuse was involved in that mix. So most people don't have a score of 1 on the ACEs study. As your ACE score increases, so does the risk of disease, social problems, emotional problems. And here's how they kind of break it down. With an ACE score of 4 or more, things start getting serious. Check this out, a score of 4 or more, the likelihood of chronic pulmonary lung disease increases 390% over people who didn't have 4 ACEs scores. Hepatitis increases 240%. Depression increases 460%. And attempted suicide by 1,220%. Those are staggering numbers. Staggering numbers. So, now the doctors back in the original article say in relation to their study of those people from their weight loss study. These experiences of childhood abuse, neglect, trauma are common, and their consequences are devastating in terms of the emotional damage, the medical diseases, and the costs of healthcare. So realistically, when you look at our patient population, not just the patient population of people suffering from obesity, but all kinds of chronic adult diseases, we're looking at a population of people who were hurt in childhood, and many of them have not discussed it. And I'm going to stop after this next quote, and we'll pick it up next time, all right? But they say, like a child's footprints in wet cement, a child's footprints in wet cement. Picture it. Picture it. You've seen little footprints in cement that's hardened, right? The consequences are lifelong. That is huge, huge, big stuff, right? We are talking about lifelong consequences from things that happened in early life. Now, I know this can be upsetting. I know it can be emotionally, like, whoa, I had no idea that. I don't want to know this. I get that. It took me years of therapy in my young life before I was willing to really look at the fact that this family that I was raised in that I thought was perfect, man, my denial was strong. It's like, don't tell me anything in my adult life. And I was young, I'm still in my 20s. I was alcoholic. I had been through anorexia. I was in awful relationships. I was just setting out on a course of self destruction. And so I thought my self destruction had nothing to do with anything that happened in my perfect family. Well, my perfect family wasn't so perfect. There was alcoholism in my family. My parents did not like each other. There was constant screaming, yelling. There was, some emotional neglect of the kids. You know, a lot of trauma. I had a sister who attempted suicide in high school. I mean, there was a lot of trauma. I did not want that to be real. I didn't want that to be my life. But as soon as I started saying this is the truth, and as soon as I got into therapy, and as soon as I went through treatment and opened up about all of it, I no longer abused myself with food or alcohol or pills or cigarettes or men. And I started learning new skills to like myself, to appreciate who I was, to accept myself, to develop a healthy relationship with food, to become a better spouse, to become a better mother. And my life 38 years later, well, let's go 32. I went into treatment about 32 years ago and started all that therapy, is a much different life. Better, wholer, more holistic, much happier because I don't abuse myself like I had learned in my childhood. But if you struggle with constant regain, let's look at if you have some of this in your background. And as you start to work on it, as you start to address these issues in therapy or a church group or with your best friends or your partner, you no longer have to act them out because they're no longer secrets. You can let go of the shame. I teach an online class called Gain While You Lose. We talk about all these things in much greater detail, but you need therapy of some sort to work through these things. And slowly over time, you'll quit needing weight or food to make you feel better or to keep you from dealing with your inner feelings. So it's a journey. There is more to come from this article, and I will go over the rest of that in the next episode of the podcast and on Thursday when we do the next Berry Aftercare Live. I typically don't share the Thursday Berry Aftercare Live on my podcast. I save it for just those people who are part of Berry Aftercare. But today this week I want to, because I want everybody to have all of this information. And please, I encourage you, share this with people you know, people who seem to really be stuck in ongoing regain or can't get over some sort of addiction or are involved in any kind of other health behaviors or unhealthy behaviors, or people who have chronic health issues that don't seem to be following the doctor's advice as to how to make it improve. Please also encourage all of the bariatric professionals you know or with whom you work to listen to this podcast, especially this session and the next one. All right, guys, that's it for today. Remember, it's your health. It's your responsibility to get the help you need. It's your responsibility this day and every day of your life. So choose wisely, get the help you need, and I will talk again with you soon. Thank you.